Today, we're talking about offloading, one of the most powerful tools in wound healing, and yet one of the most ignored. By the end of this video, you'll know what offloading actually means, how to recognize when it's missing, and how to use it to help wounds finally start healing. We're taught to look at wounds, measure them, clean them, and dress them. But what if the real reason a wound isn't healing has nothing to do with what's on the wound and everything to do with what's pressing into it all day, every day? For those who don't know me, my name is Dr. Voltaire. I'm a wound care physician, and over the years, I've treated hundreds of wounds, and I can tell you, no dressing, no ointment, no fancy tool works if the wound is still under pressure. Offloading is the missing link in too many cases. If you're a healthcare provider or just starting to learn about wound care, this is for you. You don't need expensive equipment to offload well. You just need to understand how pressure affects healing and how to work around it. And today I'll show you exactly how. Here's what we'll cover: what offloading really means and why it's not just bed rest, how pressure delays healing, the best tools and strategies for offloading different types of wounds, and real-life examples of what happens when it's missed. And stick around because at the end, I'll show you the most common offloading mistake and how to avoid it. Let's start simple. Offloading just means taking pressure off a wound so the body has a chance to heal. That's it. But here's the catch. Pressure doesn't always look like someone standing on a wound. It can come from sitting in the same position, wearing shoes that are too tight, leaning on an elbow, even a mattress that's too firm in the wrong place. Offloading means recognizing where the wound is and how the patient's daily life might be pressing on it without realizing. A foot ulcer won't heal if the person keeps walking on it. A heel wound won't improve if the foot is resting directly on the mattress. A sacral wound won't close if the person is slouched in a chair 6 hours a day. This is why offloading is more than just bed rest or elevating the leg. It's about strategic pressure relief. So here's a visual. Imagine trying to grow grass. You water it, you fertilize it, and you make sure it gets sunlight. But every day, someone parks their bike on that same patch of grass. Will the grass grow? No. That's what pressure does to wounds. It chokes off blood flow, damages tiny vessels, and crushes tissue that's trying to rebuild. Even the best dressing in the world can't compete with constant pressure. Healing needs oxygen, circulation, and time. Pressure takes all three away. So how do we offload in real life? Well, let's go through a few key areas. For foot wounds, diabetic foot ulcers are one of the most common. Offloading here might mean using total contact casts, offloading boots like the Crow Walker or a cam boot, heel cushions or foam inserts, and even a temporary wheelchair or walker if needed. But here's the trick: compliance matters. A boot that's sitting next to the bed isn't offloading anything. So part of your job is explaining why the device matters. There are also sitting wounds, so think sacral wounds, ischial tuberosity ulcers, or pressure points from wheelchairs. So here's what we think about: cushions that redistribute weight, repositioning schedules, tilt-in space chairs, sitting time limits, monitoring for posture shifts as well. Again, this isn't just about sitting less, it's about changing the way pressure is distributed. We also have bedbound patients. So for patients in bed, offloading is about surface, position, and schedule. So we use heel suspension boots, pillows under the calves, so not directly under the heels. And turning about every 2 hours or so is recommended. Also pressure redistributing mattresses. You also have foam wedges to reduce side-lying pressure. And remember, friction and shear matter too. Pulling someone up in bed without a lift sheet can undo all of your work. Let me tell you about someone I'll call Mr. T. He had a diabetic ulcer under his big toe. The dressing was perfect, the blood sugar was managed, the wound was clean. But every day he kept walking around in his regular sneakers. He didn't feel pain because he had neuropathy. He thought if the wound didn't hurt, it was fine. 2 weeks later, it was worse. 4 weeks later, bone was exposed. We had to do surgical debridement and eventually a partial amputation. Here's what he said afterwards: "I thought I was doing everything right. wait, I didn't know that walking was the problem. We hear that a lot. The biggest mistake that I see is thinking offloading is just resting. Rest is important, but targeted pressure relief is different. You can rest in a chair and still put pressure on your sacrum. You can elevate your foot and still have pressure on the heel. So remember, offloading means intentional positioning and support that changes pressure at the wound site. Not just rest, not just elevation, precision. Offloading is one of the most powerful tools we have and one of the cheapest. It doesn't require fancy dressing. It just requires us to pay attention to what's pressing on the wound and why. You can be the person who notices, who speaks up, who suggests a pillow, a cushion, a boot, and you can help wounds finally move from stuck to healing. Thanks for watching. If you like this video, check out my next one where I break down why two wounds that look exactly the same may need completely different treatment plans. Stay informed and heal well.